Welcome, everybody. First, I'd like to thank to Gina for this great presentation for me, and also to Dr. Bülent for inviting me to this meeting. I kindly request not to take photos of my patients because, you know, my patients, they don't let you to use their pictures. So, okay, so we all know about fibroblasts, dermal fibroblasts. They are mesenchymal cells playing an important role in wound healing and skin rejuvenation. What they do, they trigger cell migration and proliferation, they produce collagen and hyaluronic acid, they organize epithelial cells, and they trigger neovascularization. So that's why we have been using autologous fibroblast injections or cell therapy for skin rejuvenation. What we do here, we make a biopsy from skin, a sample, and then reproduce fibroblasts, inject them very superficially, and then wait for the proliferation of these fibroblasts, which will lead to tissue repair. In this procedure, the injections are very superficial, onset of effect is late, and we know that it's insufficient in deep volume defects. Here's a study from 2012. They did this autologous fibroblast cell injection for the leg skin of the lower eyelid, and 60 days after 4 injection, they showed a successful result in periorbital area. However, they noticed that it's insufficient in deep lines. And then we see Asvicel. Asvicel is the only FDA-approved fibroblast cell therapy, actually. And in this placebo-controlled study, 372 patients underwent 3 treatments of fibrocell therapy. And 6 months after the final treatment, they showed significant improvement at the nasolabial wrinkles. However, the earliest effect was noticed after 2 months. So the onset of effect is late for the fibroblast cell therapy. And again, we see another study, again Asvicel, it's a placebo-controlled study. This time they worked with the depressed acne scars, and they showed significant improvement after compared to control group. However, again, the onset of effect is late. On the other hand, besides this fibroblast cell therapy, we have another autologous rejuvenation method, which is plasma gel. Actually, we know plasma gel for years, but recently we see that it has also a filler effect. And last year, in 2018, we know that this plasma gel has other effects. The properties of plasma gel is more than we know. Here, in this study, PRP-originated plasma gel developed from PRP was studied regarding the growth factor content, biomechanical properties, in vitro dermal fibroblast proliferation capacity, and 10 patients with a clinical outcome were evaluated in this study. They showed that plasma gel, it's a gel-like substance developed from PRP or PPP. In this study, PRP-originated plasma gel is very rich in growth factors, biostable for catalytic enzyme degradation, increase the mitogenic activity of dermal fibroblasts, and of course, high viscosity gel is more suitable for deeper tissue defects, and all patients were satisfied at the end of 1 month, which was consistent for 16 weeks. No adverse effect was reported, and ultrasound examination showed regenerative effect. Another study, very recent study, in this study, they developed the plasma gel from PPP. This is only a clinical study. 52 cases were studied for the facial wrinkles and infraorbital fold. After 2 sessions, 3 months follow-up, they reported very successful results. So what is fibrogel? It's an autologous fibroblast filler, trademark of Gancourt, which I work with. It's basically a combination of autologous fibroblast culture cells and plasma gel. How we do it? We make a biopsy. Generally, I prefer a 3 mm punch biopsy from retroauricular area. And then this biopsy, skin sample, along with 100 milliliter of patient's blood, are transferred to the lab immediately with the lab kit. The lab kit consists of blood tubes, protective sterile medium, and informed consent form. In 6 to 12 hours, the sample should be transferred. Of course, we need a GMP lab for fibroblast cell culture, which I work with Gancourt providing this obligation. And at the lab, after sterile cell isolation, the cells are incubated with autologous media PRP. We use PRP during our cell culture. Why? Because we know that 5% active PRP promotes the proliferation of dermal fibroblasts. And later on, it was also confirmed with the study that this dermal fibroblast proliferation induction is by activation of ERK1 and 2 signaling. And then the cells go to quality control regarding cell count, viability, morphologic analysis, immunophenotyping, and infection control. After we obtain approximately 40 million fibroblast culture cells, we plan for filler. The patient and the lab are scheduled. Briefly, at the day of the injection, the filler injection, we obtain 10 milliliter 2 PRP tubes of blood sample, centrifuge to obtain PRP, and then this PRP and plasma portion are gradually heated to obtain plasma gel. This is the routine methodology of plasma gel obtaining, and then mix it with fibroblast culture cells. Here, the plasma gel constitutes the biskeleton of fibroblasts, arranging them in a 3-dimensional configuration. And we obtain a homogeneous fibrogel. In each session, we do 3 sessions of treatment, filler treatment. In each session, we get 10 to 12 milliliters of filler, which contains 4 million fibroblast cells per milliliter. For a filler development, for a bioactive structure, we need 3 components. One is cell, the second one is bioskeleton, and the third one is the signal molecules. In fibrogel, the cells are, as I told you, the fibroblast culture cells, bioskeleton is the plasma gel, and the signal molecules are actually, these are hormones, enzymes, and the only source is the patient's blood. So it's merely autologous. The indications are very similar to our conventional fillers, like scars, infraorbital nasolabial marionette lines, lip, nose, and chin augmentation, temple augmentation, cheeks, head rejuvenation, and necklines. And besides these, we can use fibrogel for large areas and deep volume defects like elbow and knee wrinkles. How I do it, I generally use topical anesthesia 1 hour before the application. In this case, in fibrogel application, we inject the filler to the deep dermis or subdermal plane using a 28-30 gauge needle or a cannula. Cannula is much better because with the needle you can see obstruction in the needle. When I see small bumps during my injection, I gently massage that area. Erythema and edema may develop, which lasts in 2 to 3 days. I always sunscreen after all my applications. And the patient may continue the daily activities. Generally, we avoid excessive exercise for 24 hours. Why autologous fibroblast filler? Why fibrogel? Because we see immediate effect like other fillers. This is important because the patient satisfaction increases in this case. It's effective in deep volume loss. The effect is supposed to be longer. No adverse effect. It's merely autologous. Non-allergic. The most natural rejuvenation. Ideal for patients who are against foreign material injection. And it's ideal for patients who experienced filler complications before. So I'm going to show you some pictures, some examples of my patients. Generally, what we see is beyond filler effect. We see an overall skin quality improvement. We see a tightening effect and even brightening effect. The pigmentation goes away. So this is before. You can notice that my patients, the ones who accept fibrogel injection, they have never had any injection or any laser treatment before. They are always, they're afraid of having something done. And so when I explain this procedure, when we discuss fibrogel, they accept this because it's from their own cells, own blood, nothing foreign. This is before, and this is 1 month after the first injection, 3 months after the third injection, and this is 8 months after the third injection. So you can see the tightening effect, the quality of the skin is getting better, and the effect is continuing actually. And again, before, 1 month after the first injection and 4 months after the third injection. This patient, before the patient, 1 month after the first injection, 3 months after the third injection, 6 months after the third injection. So how I feel, I always ask to my patients, even with the conventional fillers, what they want and what I want. So we discuss, and then I feel it. These patients, they are all, like, don't change my shape, don't change my shape. So I am trying to be respectful to their desire, and I always feel according what they want. This is before, and 1 month after the first injection, 3 months after the second injection. To my experience, infraorbital area is the best responsive area for the treatment. This patient before, 1 month after the first injection, 3 months after the third injection, 8 months after the third injection, it's getting better. The skin is improving, the improvement continues, and this is 12 months after the third injection. This is a very good case, actually, because this is elbow wrinkle, and we can actually observe what's going on in time. So before and 1 month after the first injection, 3 months after the third injection, 6 months after the third injection. Okay, I was very happy with the result. And then 12 months after the third injection, I was a little bit afraid it's getting worse. However, 18 months after the third injection is much better, and this is 20 months after the third injection. So the improvement is, continuing, so it's a very good case actually. So this patient was only suffering from the left cheek depression. The only problem was on the left cheek, asymmetrical cheeks. I wanted to do laser treatment. He denied everything. He didn't want anything. So I advised him to do this filler. He said, okay. Immediately after the first injection, as I had a lot of material, I convinced him to do some more, like the mantle crease or nasolabial area, a little bit infraorbital area. And this is 8 months after the third injection. He was very happy with the left cheek, but I was happy with the overall appearance. This is another patient before and 3 months after the third injection. If we want, we can shape the face also, like we do with other fillers. This is before the patient, and this is 3 months after the injection. So in this case, I worked the jawline, chin, lip, nasolabial, marionette lines, mid-face, actually, the cheeks and the infraorbital area, and also the upper eyelid a little bit, below the eyebrows. So we can, if you want, we can use it like shaping of the face. Oops. So this is knee augmentation. So before and 3 months after the third injection, so we can use fibrogel actually for knee wrinkles and elbow wrinkles. So it's good. So ideal filler should be long-lasting, effective, immobile, non-toxic, non-animal based. Easy storage and application is important, and we want low risk of complications, of course. Fibrogel provides most of them. Of course, it's a little bit expensive, but when you think of the milliliters that you have been using with fibrogel, 3 sessions, in each session 10 to 12 milliliter, if you use a conventional filler, hyaluronic acid or calcium hydroxyapatite, whatever it is, it's much more expensive. So we can say fibrogel is a more sophisticated autologous fibroblast cell therapy, providing both the generation of matrix proteins and replacement of volume loss, which results in a sustained therapeutic effect. Thank you.
And also I have a question to Dr. Yasemin. Actually, after the operation, when do you need to repeat the treatment?
We generally do it once monthly, the 3 sessions. Sometimes the patients are not suitable for the procedure after 1 month, and I can do it in 2 months then, but 1 month apart.
All
1
right.
month apart.
All right, thank you.
You're welcome. Okay, now my patients are the longest period of follow-up is 2 years actually. So still she doesn't need it. But if she needs, we can do it again. Sometimes they keep their cells at the lab. So it's easy then. But if they don't keep their cells, so we take another biopsy and reproduce the fibroblasts again.
Why don't we see scar after injection, after injecting the fibroblast?
Scar?
Yeah, scars.
For acne scarring?
Yes. Why don't we see scars?
Why do you expect scar development?
Because there is no collagen. It's only fibroblasts. We only see fibroblasts. So why there is no
fibroblasts actually overproliferation and you are talking about hypertrophic scar development,
yes.
Is it? Okay, so we don't see it because there is a loss of fibroblasts with aging of the skin. So we actually replace that loss for the aging skin. For depressed acne scars, there's again a loss of dermis. So we replace that volume loss with fibroblasts. So when there is loss, you do you replace the loss actually. And also the fibroblasts here, when you look at the scar development, the process is like this. There's a trauma on the skin, a cut, anything, and then for wound healing, the fibroblasts come to that area and then proliferate. And when the wound is closed, the fibroblast proliferation stops. And if it doesn't stop, the proliferation, if it continues at the scar area, you see at the incision or excision or at the trauma area, you see that scar development, hypertrophic scar development. Here, there is no trauma. We are not expecting any response to trauma apart from the injection, needle injection. So this is not a scar development base, actually.
Okay, thank you.
You're welcome.
And if I may, I have one technical question. From the time of, maybe I miss it, from the time of biopsy to time of application, how much time?
Yeah, we need 45 days,
45
30 to 40, mostly 45 days to develop the cells and to do the first injection. Okay. And I agree with you. This is not just a fibroblast thing. I didn't explain because I didn't have that much time. But the fibroblasts we put there, they produce cytokines and other inflammation mediators. So they are actually organizing the new tissue.